Flexion, extension, and hyperextension. Flexion is the decrease in the angle of bones forming the joint. Extension is the increase in the angle of bones forming the joint. And hyperextension is an increase in the angle of the bones forming the joint beyond the anatomical position. Dorsiflexion and plantar flexion. Dorsiflexion is the flexion of the foot at the ankle, and plantar flexion is the extension of the foot at the ankle. Abduction and adduction. Abduction is a movement of the bone away from the midline, and the adduction is the movement of the bone towards the midline. Rotation. Rotation is the movement of a bone around its longitudinal axis, and we have two kinds of rotation, and that is the medial rotation and the lateral rotation. The medial rotation is the rotation of a limb so its anterior surface turns medially, and the lateral rotation is the rotation of a limb so its anterior surface turns laterally. Circumduction. Circumduction is the movement of the distal end of a bone in a circle, while the proximal end forms the pivot joint. Eversion and inversion. Eversion is the movement of the sole of the foot laterally, and the inversion is the movement of the sole of the foot medially. Pronation and supination. Pronation is the rotation of the forearm when the palm is turned inferiorly or posteriorly. Supination is the rotation of the forearm when the palm is turned superiorly or anteriorly. Protraction and retraction. Protraction is the movement of a body part anteriorly, and retraction is the movement of the body part posteriorly. Elevation and depression. Elevation is the movement of a body part superiorly, and depression is the movement of the body part inferiorly. Opposition and reposition. Opposition is the movement of the thumb to touch the other four fingers, and the reposition is the movement of the thumb back to the anatomical position.